We're here at the CROI in Boston. We're here with Tamas Bereczky, and he is the communication officer of the EATG, and also from Hungary. And we're appreciative you taking the time because you've got so much to tell here. We sat and talked for a long while, and I don't know how we can cover it all, but I think the first thing we want to know is what is the EATG and what does it do?
Sure.
And because it's a little different in Europe than the group we have here.
Sure. Well, first of all, thank you very much for having me.
Sure.
So the EATG, the European AIDS Treatment Group, has been around for more than 25 years in Europe, and it's one of the largest networks of people living with HIV in Europe, living with and affected by HIV. And basically what we do is we try to represent the interests of people living with HIV in various ways. And our activity is built around three key pillars, if you like. One is science, the other is policy, and the third is education or capacity building, if you like. So science is the European Community Advisory Board, which is very similar to what you've been doing here in the US as well with EATG. Mm-hmm. It is a community advisory board which has, over the last more than 20 years, very successfully built up a team of expert patients who are people living with HIV, like myself and my peers, who have educated themselves about HIV and the medical science of it, but not just that, also the social science of HIV. So that would be the scientific part, where we have regular meetings with industry, regulators, academia, and try to follow up on whatever is happening in the field of HIV-related research. For many years, this was strictly hard science and medical science, and now over the last, I would say, 5 to 7 years, it's been increasingly infiltrated by social science, as well as we realize that it's just impossible to separate these things from each other. Now,
it's apparently originally we talked because we're so desperate to get the drugs out that we were working really hard at that. Now it's implementing or delivering the drugs.
Exactly. I mean, there was I think that was 2 years ago or maybe 3. When there was one of the European AIDS conferences when one of the researchers pointed out that basically the science in HIV treatment, the science is done. The real question now is how you deliver those drugs to the people. Mm-hmm. So how you make sure that people actually not just have access, but also take take that medication that is needed. So the second pillar is policy, as I said, and policy, we take this very seriously. Policy is actual political lobbying for the interest of people living with HIV. Mm-hmm. Although the EATG was originally established in Germany, we have our offices in Brussels in order to be closer to the European Union and the European Union's institutions. And the EATG has been recognized as one of the lead partners of the European Parliament and also the European Commission. And the European Medicines Agency, which is the counterparty of the FDA in Europe, in terms of everything HIV related. So they consult us on a regular basis in order to get our opinion on policies in HIV. There's a very intricate, complicated structure how this is built up, and I will not go into that. But fortunately, we managed to get to the point where we really have very, very deep political contacts and roots within the European Union and beyond. Because the EATG works in WHO Europe, which is a much larger, it's 53 countries rather than just the European Union. And then the third pillar of our work is training, education, and capacity building, which is partly internal. So we will teach our own members about the science, policy, how to do activism, how to what advocacy means. And it's partly external. We train, for example, new advocates, young people who want to work in the HIV field as activists.
You do that with education and mentorship?
Sure. We do both. So we have courses, training courses, For example, there is the Step Up Academy, which is for young activists and advocates. It runs for a year. People come to Brussels, I think every second month, for a whole weekend when they learn about HIV, immunology, they learn about advocacy, how advocacy is done, what are the good practices, what we've learned from around the world. And they also get scholarships for conferences, so that they get this initiation into, attending conferences, what you do, because it can be very overwhelming. This is, I think, the right place to say, because CROI is really overwhelming, yes. Even if it's not your first time. But for a young person, and if you're here for the first time, it can really, it's very difficult to keep up with the pace, and that we try to teach this also with mentoring. So I also mentor people within the EATG, and all of the longer standing members will take other young activists under their wings and try to teach them how to do it, and not just that, but also help them, because Europe is a very diverse area. It's not, we were talking about this before, and you mentioned Michal Kazachkin's name, who's, by the way, member of the external supervisory board or advisory board of the EATG, and a very good friend of our organization. He pointed out that Europe can be divided into at least 3 distinct areas. So Western Europe, Central Europe, and Eastern Europe, and the problems and the solutions, the epidemics are very different in these 3 areas.
And Michel, he has the Eastern Europe and Asia. Is that his?
Yeah, Eastern Europe and Central Asia.
Central Asia.
That is his key area of work. But he comes from Paris, so he also is familiar with whatever is going on in Western Europe, and you also should see that these populations, the affected populations in Europe, travel. So it's not like they stay put, but it's, especially if you look at MSM or gay people, they travel a lot. So and oftentimes the epidemic or the epidemics, because we speak about this synergy of various epidemics, travel with them. So we have to be there and understand whatever is going on.
So when you meet with the EMA, for instance,
Sure.
do you meet, you say regularly, is that like twice a year or something like that? Or?
It depends. So first of all, we have EATG members who sit in committees of the EMA. Patient involvement in the EMA's work is a law, which was adopted a long time ago, and it's being implemented gradually. They must include patient representatives in every committee and subcommittee
That's
and
what I was
working
getting
party.
at.
Yeah.
Whether you meet separately as a group with the EMA, and then maybe you have people that are nested into the groups, so that you're meeting with physicians as well as researchers.
Yeah,
and so forth.
that's true.
Yeah.
And also
so it's really
regulators.
integrated. Yeah.
Deeply integrated. But it's work in progress. So it takes a lot of time, and this is also why the EATG has become one of the lead consortium members of EUPATI, the European Patient Academy for Therapeutic Innovation, which is specifically designed to teach patient experts and advocates from all various disease areas about how to do advocacy and how to become meaningful partners to regulators, academia, and the industry as well. So how you can protect yourselves, how you can protect your interests, and also represent your own voice, not just in the HIV field, because we've done, and you in the US as well, we've done so much in the HIV field, but it's unique if you look at other disease areas. Maybe cancer, some cancers where you will see a similar level of development.
Breast cancer, we've got.
Breast cancer would be a very good example. Nancy Brinker was ambassador to Hungary. She also, brought that movement in breast cancer with her to to Hungary, but in other disease areas this is unheard of, and so we work in this particular structure in order to show this model to others in other disease areas, how this can be done in a meaningful way. And there are other projects like OpTest, which is about optimizing testing strategies in Europe, because we have huge problems with that. So if we talk about the 90-90-90 target, even at testing, we have tremendous problems in terms of getting the right populations tested.
Yeah, because you have the stigma and people just are hiding out.
Yeah.
So that does nothing for nipping the disease in the bud.
No.
It's going to go on and on. So I keep on asking this question:
Go ahead.
How can we make a change in this? How can we in our country help? Is there something that we can do? I mean, obviously, détente is something that's good to do for political insurrections and so forth. But this is a health insurrection.
Yeah. I think that working together is absolutely essential, that we keep this contact alive, and that we realize that even though there are huge differences across countries and all over the globe, if you look at Africa or Asia or Europe, political systems are different and the epidemics may be different, but the experience, and I'm a social psychologist, so I will, this is really something that's very close to my heart. The very experience of living with the virus will always be the same. So, and it is associated with a number of social collaterals that will always be the same. Experiencing stigma will always be the same. And I think that we have to get back to that bottom line. We have to get back to those basics and, just peel away the politics from that and concentrate.
It's a health issue. It's not. It is political, but we're trying to make it more of a health issue.
It is a health issue, and I think that this is the right place to say this, because this is mostly doctors who are here and researchers who can be key partners, key allies in this, because they really understand how this is a health issue. And also, I think that it's absolutely essential for all of us who work in this field as affected people that we educate ourselves. So I'm a researcher, and I prefer to think about myself as a researcher who happens to live with HIV and HCV, rather than a person with HIV who happens to do a little bit of work in social science. And I think it's a tremendous difference, how you look at yourself. So if you educate yourself, and if you know about your illness and you know about your body, and our bodies are very similar regardless of the political and social environment. So if you know about that, if you know what the virus does to you, and how you can work towards sustaining your health, then those are the common points where we can start working together, regardless of which part of the globe you live.
Right. You said to me earlier you don't have any doctors from your country here.
No, unfortunately not.
And that's not essential, but it would be nice to have that, because you could.
Wouldn't it?
Yeah, it would be. And of course that also is part that there's not research going on that would be presented here.
Yeah.
So is there any research going on that's presented somewhere else?
No, but and we were talking about this. We tend to think, and this will go a little bit beyond HIV, but still, we tend to think that science is what's done in English, which is not necessarily true.
Yeah.
Because we just don't know. Honestly, I don't know much about this, but we just don't know about all the science that's done in Russian. It's a huge part of the world where people speak Russian, not just Russia, but it's also Central Asia. So all the former areas of influence of the Soviet Union, people still speak Russian and they do good science. Do you know anything about that? No.
No, I don't.
Do you know anything
I was
about
shocked to have you tell that to me.
Yeah. But do you know anything about the science that's done in Chinese? No. Because you get a handful of researchers here at CROI who come from Harvard and they do science in English. But I mean, that's a country of 1.2 billion people. Do we really assume that nobody else does science there? So it's so it is. So the you know, the problem is, and you mentioned the word isolation. So who's isolated here? I think there is this tremendous barrier that we should try to look at and try to bring it down in one way or another, which keeps science from flowing. And I will not even go into, how there is this fetish of science done in English. For some reason, that seems to be the right science. Why, we don't know. But I mean, unfortunately, there's not much science going on in Hungarian or in Hungary right now because we have so tremendously big economic and political problems that, science is a little more silent now.
Yeah, well, we experience our own quiescence of not, mostly it's because of funding. We flat fund this or sequestration that, or it's unfortunate, but the NIH doesn't get nearly the money it needs, and nor does therefore not the academia to do the research. So it's still a lot of money that's going that direction, but we have to be very careful how it's spent. Yeah. But I would love to see a way that we could have collaborations, at least some sort of meeting between Russia and China and the United States and Europe.
Yeah, well, we've been trying to do that at the EATG to a certain extent. And also there's this plan which has been floating around for a long time to organize a global meeting for community leaders. So not something like the IAS conferences or the AIDS conferences, which really is this patchwork of everyone, of all stakeholders coming together, but specifically for community leaders, communities of people living with HIV, who could then perhaps sit around a large table and discuss what the common points are, especially if we really take the 90-90-90 targets seriously. That will not happen without involvement of the affected communities. Yeah,
and I mean that's happening in Africa. It's not happening in other countries, even in our own country. I mean, it's kind of crazy in a way. I mean, I like to see where it's actually happening, but or potential to happen.
Switzerland.
Yeah.
But that's the only country in Europe where it is happening. And then the UK is getting closer to 90-90-90, but if you look at Russia and if you look at the treatment cascade, and there was actually I made a little bit of a scandal about this when I mentioned it in one of the conferences in Europe, that we talk about improving the treatment cascade or the treatment continuum. But if you look at Russia, it just doesn't exist. So what do you want to improve on? Because if you look at the final target, people with suppressed viral load, it is at 7.5% in Russia currently. If you measure it at 1,000 copies, and if you measure it at proper 50 copies, then it's under 2%. So there's a lot to improve.
Yes.
How are you going to do that in a country where there's no harm reduction done at all, and 90% of people living with HIV are injecting drug users? So it is a political challenge, but not just that. It's also a challenge for our own communities. How you can work together and make a meaningful impact in a situation like that.
There's definitely the work to be done, and I don't envy you at all. That's just a challenge and a half.
But it's also fun,
well,
to a certain extent.
A number of people have said that. You got to keep it fun because that keeps you interested. But it's whatever it is that works for you. I think that's the other way I'd like to look at it. But I enjoy doing the work. I still enjoy my life. And I think like Jim Pickett said, Prep for Love. You know,
Right.
we gotta,
Yeah.
So maybe we need to get those campaigns going in Eastern Europe. That might
Yes.
might be the way to go.
Yeah.
I don't think that would sell as well there, but it definitely does sell in Chicago.
Well, I think it could sell to a certain extent, but you also need to do different things differently.
Mm-hmm.
But
It's a matter of socialization of a community. It's
Yeah.
how the community socializes and
Yeah.
how they live.
But you know, oftentimes it seems so easy to take a model from the United States or from anywhere else and try to import it into Eastern Europe or Central Asia, and saying that this is the way how it should be done, because this is the way how we did it and it worked.
Yeah.
But these places are culturally totally different,
it's the
so
culture.
it won't work.
Yeah.
And maybe it will not lead to war, like, you know, in other places when some countries try to export democracy into other countries, and I will not go into details here. But it's so maybe it will not lead to war, but it doesn't improve the situation at all, because it's really. Let me give you this example. Like in Europe, we always, and when we talk about MSM and when we talk about drug use, we always keep hearing about different things that are being done in London. That everything is perfect in London, and we have these tremendous services in London, and gay people who use drugs are served on an extraordinary quality in London. But then as soon as you leave London proper, it's all gone.
Yeah,
And
we have
so
the
it's
same
not
thing in
just-
our country.
Exactly.
That's it.
So it is, so that's why you have to look at the situations. You know, look at the situations in the given places. Having said that, I still maintain my original point that living with HIV and living with this thing in your body and making it part of your life will be the same regardless whether it's in Mozambique, whether it's in Russia, whether it's in Hungary or in the States. It's always going to be the same, and that's exactly what we should rely on in our joint work.
Thank you so much for
Thank
being
you.
here. Thank you for spending the time with me.
Thank you.